The U.S. Supreme Court is debating the limits of birthright citizenship. Doctors say what they decide could impact not just immigration policy, but also the delivery room. From Seattle, Sharon Yu explains what this could mean for health coverage for babies.
The moment a baby is born, a clock starts ticking. Dr. Philip Riley at Seymour Community Health Clinic is familiar.
I've delivered hundreds of babies.
Riley says hospitals immediately begin paperwork for a birth certificate, a social security number, and for many families, enrollment in Medicaid or Apple Health in Washington.
That paperwork starts. They don't get a social security number then, but they start the process.
But as the Supreme Court considers birthright citizenship, doctors like Riley say those automatic steps could become more complicated, especially if parents fear for their own immigration status.
If you're scared that I'm going to wind up in a bad situation, abandoning my infant, then maybe I should just leave my infant as an unregistered person.
Seymour's Vice President Michael Leung fears the worst, that babies born without U.S. citizenship could face barriers to crucial care.
They would not be eligible for Medicaid, and it's important that the children get the care that they need.
Specifically at Seymour, nearly 9 in 10 children, about 88% of their patients 0 to 17 years old, receive Medicaid coverage. National statistics show Medicaid covered over 40% of all U.S. births.
What could be worse than having a child who needs medical care that you can't get? So we struggle with that for adults who don't have citizenship. And so if that happened to infants, it would just be devastating.
While Seymour and other community health clinics in Washington provide care regardless of immigration status or health care coverage, Leung says repealing birthright citizenship would cascade into more need.
That would be an additional challenge. It would be an increased financial burden for us.
The nation's highest court isn't expected to issue a ruling on this until late summer.